Good afternoon, everyone. I'm Dr. Nelson, physical therapist. Today, I want to talk about a recent injury from Juju Watkins, a star standout sophomore guard from the University of Southern California. She recently sustained an injury in her right lower extremity. So, while going to the cup or the basketball hoop, as you can see in this video, she was going to make a play. And in doing so, you can see that her right lower extremity, her knee, it buckles in inwardly. So, inversion in this direction. And in doing so, it put a lot of stress on a lot of ligaments in her knee, more specifically the ACL injury, which is the most or one of the most common injury by athletes that do a lot of cutting and movement and so forth, as I stated in previous videos. So she initially was trying to make a cut. She was going right, and then she was trying to cut to the left to go straight to the hoop, and she lost control of the ball. She completely fell to the ground. And as you can see through her grimace, it's devastating pain, excruciating pain. So after reports come forward, it states that it is confirmed that she has an ACL injury. So what is an ACL injury? It is an anterior cruciate ligament. It is one of the major ligaments in your knee that helps to stabilize your knee in movement, especially movement, lateral movement, and all the movement, stability in your knee. And when this is ruptured, now you're put in a situation there's not as much stability in your knee. And if you don't have surgery, what happens is you put stress on all the other ligaments and you further put yourself at higher risk for more injuries. So in this case, individuals or athletes that usually do high intensity sports, surgery is recommended. And she went in and she underwent a surgery, and it takes about 9 to 12 months for recovery. And this is if it's managed properly. There's no complication throughout the actual journey. So the first 0 to 6 weeks is just motion, mobility, getting her back on her feet, getting her muscles being utilized as well from the atrophy. From about 6 weeks to about 3 months, it's more aggressive therapy. So that requires more standing weights, more squats, in tolerated motion, and more movement, maybe walking on a treadmill. From 3 months to about 6 months, it gets even more sports specific. So it gets back to doing everything that she was doing before. So minor pivots, minor movement here, minor jumping, and so forth. And from 6 months to 9 months, it gets even more aggressive. All right. So this is when they're transitioning back into their role or into sports. So this requires maybe running further, running longer distance, doing higher jumps. And from about 9 months to a year, it's more sports specific. So this is when she gets back to practice and start to practice those drills. So it takes about 9 months to 12 months, depending on the individual, their age, their level of activity prior to the injury, and so forth. So this is not a